spots. And you can do the same test looking at a newspaper, seeing the line is straight or wavy. So if you look at the racing forms, the Wall Street Journal, and you can't see all the numbers, part of it's missing, or part of it's wavy, or you always think the 1/4 is really a 3/4, and everybody says, oh, it's wrong, you know, come in or see your stockbroker. No, just joking. But it's very important to get some sort of diagnosis, because now we have great treatment. Most of age-related macular degeneration, 90% is dry, meaning it's inactive. Only that your macula is fine and the rest are the little yellow dots, but it's really dry. Nobody has any symptoms. Everyone's seeing very well. But that 90% becomes wet any time. 10% is wet. That causes the severe blindness.
So most patients with these early changes have this dry condition.
Right.
And do you treat those patients, or do you only treat the patients who get the more advanced?
Now when you have the little drusen, which is called intermediate age-related macular degeneration, so you still have 20/20 vision, but you have those yellow spots all over, we start treating them on vitamin pills, part of the AREDS study, which came out 10 years ago, supported by the National Institute of Health. We found out that 20% to 30% will gain some benefit from that and keep their vision, to prevent from the yellow dots from proliferating. That is the reason that they think the UV light or not enough blood flow is causing this. The other factors that they think that cause the wet age-related macular degeneration is the combination of having the smoking, the UV light, eating the high sugar content food, the genetic component having complement factor H, which causes an inability to take care of the complement pathway, which leads to inflammation. So if you're missing this gene, you're kind of in an inflamed state all the time, and you have these drusen formation. And then there's something called vascular endothelial growth factor, which is released by the eye, and they think that all these other conditions cause this release to cause the bleeding. Once you have the bleeding, we have great treatment, Lucentis, Avastin, and Macugen. And their real names is, they are monoclonal antibodies that block the vascular endothelial growth factors, and it's called ranibizumab and bevacizumab and pegabtanib. And so Lucentis is ranibizumab, and that is a small fragment that we inject right into the eye, right in here with a very small needle. No injection needed for anesthesia. You just get topical numbing drops done at the doctor's office in the slit lamp. Under sterile conditions, we wear gloves, we betadine the area around the eye, and we watch the patient for about 20 minutes afterwards to make sure there's no untoward side effects. And we found out in the last 5 years that there's a 60% improvement versus 90% improvement. So 90% improvement if you have the injection, and placebo 60%. And so if you have this drug, you maintain your vision or improve by 3 lines over 1 year. So we can therefore take somebody who could not pass the driving test to passing the driving test.
Wow. So the majority of patients have the mild type, that's the 90%, have the dry macular degeneration. And for those patients, you counsel them to modify their diet, eat carrots perhaps.
Eat carrots, take the vitamins. Yeah.
And then if they advance to the wet type, that's when they have more significant symptoms. And it sounds like the treatment is to minimize the effects of the growth factors that are being overexpressed for whatever is stimulating them, and you're blocking them with these new drugs?
Yes. And one of them is covered by insurance. That is Lucentis, which is ranibizumab, and that is a great boon to the elderly population, everybody over 55, who have wet age-related macular degeneration. And in the last 2 years, all the retina specialists in America have found profound improvement in vision. And so that's why a lot of people don't mind having the small injection in the eye, because it is really, profound improvement. They notice it within a month.
That's very exciting news, because when I was a medical student, I always perceived macular degeneration as basically untreatable.
It is really wonderful for these patients, because up until then, we really didn't have great treatment. We had laser, which stopped it and kept it at that level, but we really did not see regrowth of retina and normal retina, and we're beginning to see that. And now we're doing these injections in combination with laser and even other injections to underneath the eyelid with their new experimental drugs, where instead of injecting in the eye, they go underneath here.
Can one prevent macular degeneration?
People are trying to figure out what are the reasons for it, and they're trying to have new drugs, but it's very hard, because it's hard to biopsy the eye, and it's hard to get a good animal model or a tissue culture model to really look at preventing. But prevention now is really centered on diet. If you wear sunglasses to prevent UV light exposure, so we're in some way like the dermatologist. So once you have little children, put them with sunglasses, a hat, so any amount of sunlight, any UV light is no good. So it's lifetime exposure. So even when it's an overcast day, wear sunglasses. And especially if you have relatives with age-related macular degeneration, or if you have drusen, intermediate age-related macular degeneration. Those are the yellow dots. So that would be on a rug where the center is smooth and clear, but on the edge of the rug you have big yellow oranges or big yellow mounds. One other thing is that they found out that people who were placed on anti-cholesterol drugs, statins, had less age-related macular degeneration. So people understand that lipid, high cholesterol, is playing a role. They're not exactly sure, but they're ongoing studies. We did a study in our office where we looked at Asians and Caucasians with high lipids and how their drusen looked in their eye. So the higher the amount of your blood cholesterol, the more lipids you had after age 55. So this is even at a very early stage when you have 20/20 vision and driving vision. So we took very early patients. So that's very interesting.
Will controlling your cholesterol reverse those changes?
We have found that controlling cholesterol over 2 years, that their drusen got smaller. So instead of being a large orange, they became smaller oranges. So the progression was in the right way, rather than getting bigger and bigger.
And that presumably will then decrease the conversion to the bad type, or the so-called wet macular degeneration.
Right, and the bleeding. And we really want to prevent that, because obviously that causes the profound visual loss when you start looking outside the landscape and you're missing your neighbor's house, or you can see your grandchildren's body, but you can't see the face on the grandchild because you're missing that part. And people really have to learn to look sideways. And we're doing studies also on how to help people where one eye is lost. It's so profoundly gone for many years of not being diagnosed, and there's one eye left. For the one eye that's lost, people are patching the good eye and training them to see off to the side. There is work on that, to sort of low vision techniques and trying to regain some sort of rehabilitation in vision.
So can you take our audience through what happens if a patient comes into your room and says, my Wall Street Journal stock listings are curvy?
Oh, they would come, we would test their vision, look at an eye chart, then we would check the front part of the eye, so we'd make sure that the front part is working. We check their pupils to make sure that the connections between the optic nerve and the brain are working.